Good afternoon. Today is Thursday, December 31st, and this is our weekly COVID-19 update briefing. We missed 1 week last week, so this is 2 weeks worth of data we'll be presenting today. As of today in Bossier Parish, we have unfortunately experienced 8,868 positive cases, and unfortunately we have now 194 deaths. Governor Edwards recently announced that, and I quote, Louisiana has entered a new and very dangerous third surge of the COVID-19. The number of positive cases, increased hospitalizations, increase of deaths, and the impact that this has had on their hospitals' capacity and medical staffing resulted in the state regressing to a modified phase 2 of the recovery. He has stated that, and again I quote, all the information we get from the White House task force and medical experts have said that we're in for a couple of really tough months. Unfortunately, that is now occurring. The tough months are here. They predict an increase in positive cases now that the cold weather has arrived and more people are staying indoors. Louisiana continues to see a concerning rate of community spread of COVID-19 in all areas of the state. The governor has issued proclamation number 209 to continue in the modified phase 2 until January 13th of 2021. Hospitals have indicated that the latest trajectory of cases, if they continue unabated, will overwhelm their facilities. We must not overwhelm our hospital capacities to deliver health care. Unfortunately, many hospitals are now at or near that point. In Proclamation number 29, the Governor stated that should there be an increase in the number of confirmed COVID cases, the percent of positivity of testing, or should the number of COVID-19 cases and related hospitalizations threaten the ability of our healthcare system to properly respond, it may, and I repeat, may, be necessary to go back into the full restrictions in the stay-at-home order in Proclamation number 52. The governor has conceded that strict statewide enforcement of these directives is not feasible. He has stated that, quote, if people insist we enforce our way through this, we are doomed to failure. He urges that we be good neighbors and voluntarily and consistently comply with the prevention and mitigation protocols. Determining the priorities for the vaccination and the logistics of distributing them is in progress. Among the first being vaccinated are healthcare providers, hospital employees, and individuals living in assisted living facilities and nursing homes. The state is scheduled to receive 79,000 vaccines, 39,000 initially for the first vaccination, then an additional 40,000 for the second vaccination to achieve 95% efficacy. Vaccinations began in the local area last week, but there have been some problems in distributing the vaccines, delaying the number of vaccinations anticipated at this point. The vaccines for the general populations is still projected to be in the May or June timeframe of 2021. The firms of Walgreens and CVS have been contracted to play a major role in the vaccination process. Also, FedEx and UPS are also performing a key role in the distribution of the vaccines. The governor announced today two very important issues. First, the pharmacies will receive the pharmacists that receive their vaccines will only give these shots by appointment. Don't go to the pharmacy to get a shot unless you have an appointment. We don't want to have people stretched out for blocks if there's no possibility of getting them in. So the only way you'll be able to get it was an appointment with at these pharmacies that have them. I understand that the location and phone numbers of the participating pharmacies will be posted later. Next, the governor announced a change in that individuals in Louisiana Category 1B Tier 1 which is the age group to be among the first to get the vaccine, was set by CDC at 75, but the governor has lowered it down to age 70 because the statistics for our state show that that's where the majority of the people in our state are getting it. So that's a reduction in the CDC recommendations from 75 down to age 70. There's also concern that when the vaccines are available, and they are becoming now available to the general public, there may be some reluctance by some individuals to not take the vaccinations. Some have legitimate medical and religious reasons to avoid the immunization. Others simply prefer not to. If a significant number of people refuse the vaccinations, we may not be able to achieve herd immunity. It has been reported that it takes approximately 75 to 85% of the eligible populace being vaccinated to achieve herd immunity. The effectiveness of the vaccine will be minimized if large numbers of people refuse the vaccination. Medical experts say that it is not unusual to have some mild side effects for a day or two following the vaccination. The governor said this morning that the experience so far among the shots that have been given has been little to no significant side effects. Former Presidents Obama, Bush, and Clinton have publicly stated their willingness to take the vaccine to demonstrate that it is safe and effective, and to encourage the general populace to get the vaccine as soon as they're eligible. President-elect Biden and Vice President-elect Harris have already taken the vaccination. The numbers of individuals who are asymptomatic is estimated to be between 40 to 50%. They do not develop the symptoms, but they can have and transmit the infection, causing illness and possibly death to others. The wearing of masks remains a major issue of concern. It has been directed in order that every individual in Louisiana, age 8 or older, shall wear a face mask covering the nose and the mouth when inside a commercial establishment or any other building or public space open to the public, whether indoors or outdoors, and includes public or commercial modes of transportation. The CDC now also recommends that children aged 2 to 7 wear masks. They are concerned that with the spread of the virus through small gatherings such as weddings, Christmas celebrations, New Year's celebrations, the holiday break from schools and colleges, is where a lot of this passing of the virus is going on, when people just tend to let their guard down a little bit during these social times. The prevention and mitigation protocols remain unchanged, and they are: first, wear a mask, wash your hands 20 seconds or more, cough into the bend of your elbow, do not touch your face, disinfect surfaces, social distance of at least 6 feet. If sick, stay at home and follow the advice of your medical provider. Number 9, avoid crowds, but the big emphasis remains wearing of the mask, washing of the hands, and social distancing. A major change was recently announced by the CDC and the Louisiana Department of Health concerning the number of days a person should quarantine. The CDC is now allowing quarantine times to be shortened to 10 days on day number 11 if no symptoms have been reported during the daily monitoring. Also, they say that quarantine can be shortened to 7 days on day 8 if the individual takes a COVID-19 test and receives a negative result. The Louisiana Department of Education has given school systems the green light to go ahead and start relaxed quarantine rules immediately at their 1,700 schools. The CDC hopes that these shorter quarantine periods will encourage more people to receive the vaccination. However, the Louisiana Department of Health still recommends 14 days for such areas as nursing homes or correctional facilities, areas where residents and staff are in a congregate living situation. Just this morning, Governor Edwards announced that the state's situation is worsening. we're at we're plateauing, which is a good thing, but unfortunately we're plateauing at a too high of level. Our number of positive cases is now at 10.7, which is a little over twice the goal of what it should be, of 5% or less. He pointed out that the issues regarding the receipt and distribution of the vaccine have surfaced growing pains and complicated the process, but hopefully we will start receiving more vaccines and get them to the right locations and used here in a more efficient manner very shortly. It's just some growing pains in the distribution process. Ladies and gentlemen, today, as you know, is New Year's Eve, so please practice the prevention and mitigation protocols during this critical time. I thank you for your continuing participation in our joint fight against this deadly pandemic, especially at this critical time when the nation's ability to provide needed health care is in jeopardy. Our next scheduled briefing will be Thursday, January the 7th. I wish you and your family a very happy and a healthy new year, and for 2020, good riddance. This concludes today's briefing. Thank you and good day.